Hello, 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 hello. Hi, I'm just trying to set it all up. I'm gonna post it on the screen. Oh, thank you. A little messy. Thank you, do red, but I didn't know how they were gonna be in school with that, so that's why I didn't do red hair in the beginning. Can everybody hear me? So, okay. Thanks. All right, share screen. All right. I remind everybody to join. Trying to give everybody like time. I see people joining in now, so. We'll start at 5:10. I'm just giving everyone time to join so we can have people in the game. You gotta download Kahoot, K-O, the name of the game, and then you put in the code. The PIN number is 237-911-1997. 237-1997. Yeah, you just download the Kahoot app. It should be an app on your phone. I'll see if I can send the link. Hold on a second. I have to have two screens because you need to be able to see the questions. So you gotta have your YouTube going at the same time as the Kahoot game if you can. Hold on one second. Hold on, I'm trying to explain to people how to get on. Yes, I'm so happy to work there ever. All right, giving it like 2 more minutes. Yeah, it kind of lags. The screen might be a little blurry. It kind of lags. We're gonna start at 5:15 so I can give everybody a chance to sign in. All right, 5:15. We're waiting 5:15. All right, starting in 2 minutes, 5:15. All right, we're starting in like a minute. All right, we're starting now. All right. The first question is coming up. What assessments are important for a nurse caring for a patient receiving desomesopressin? The red is blood pressure and serum potassium. Blue is heart rate and serum calcium. Hold on. Let me start over. Hold on. Only one person answered. Hold on a second. Can you pull it up? One second. One second. Can you see it now? Can y'all see it now? Yes? Okay, got it. All right. All right, next question. Sorry. All right, we'll get to the next question. Sorry about that. A 45-year-old woman reports severe hot flashes and poor sleep. How should she use hormone therapy? Can you guys see the answers? Red is very safe and may be used freely. Blue, used at the lowest dose for less than 5 years. Yellow, necessary to prevent osteoporosis. Green, it may be used indefinitely. Answer is blue, used at the lowest dose for less than 5 years. I see a couple people got it. Um, Hormone therapy should be used at the lowest dose for as possible for less than 5 years. Women should use hormone therapy at the lowest dose possible for a period less than 5 years due to risk of breast cancer and cardiovascular disease. Did y'all see that? Or I'll go next. Okay. A patient on glucocorticoids needs a slow taper to prevent which condition? adrenal cortical insufficiency, for those who got it right. I see you, Sarah. It's in our textbook. The prototype drug will be prednisone. Oh, I'm so sorry. Yeah, I'll repeat the answers for now on then. Wouldn't let you answer. It's in a textbook. This one is about prednisone. That's the prototype drug. A patient reports that they are taking a rapid-acting insulin with meals, but can't remember the name. Which one is a rapid-acting insulin? Red would be Humalog, yellow would be NPH, blue would be regular insulin, green would be insulin glargine, which is Lantus. This one is, as you can see, insulin lispro, which is Humalog. I'm trying to go back to my screen. Hold on. It's hard to navigate. Oh, wow. Sorry to hear that. It was insulin lispro. Insulin lispro is a rapid-acting insulin that starts to work within 15 minutes and is used to control blood sugar levels during meals. Oh, I'm hoping so. My grandma has had it for years, so I know what it's like. Okay, next question. A patient gives regular insulin 45 minutes ago, is experiencing nervousness and tremors. What should the nurse do first? Patient given regular insulin 45 minutes ago is experiencing nervousness and tremors. What should the nurse do first? Red, administer glucagon. Yellow, notify the kitchen to deliver the tray. Blue, give the patient orange juice. Green, perform bedside glucose. And the answer is give the patient orange juice. You would give the patient orange juice because they have hypoglycemia. The nurse should give orange juice to quickly raise blood sugar levels. Any other action wouldn't be before the other actions. That's the priority action. Glucagon is given for patients unable to ingest carbohydrates. The nurse receives an order for IV NPH, Humulin NPH, 10 units. What should the nurse do? Red, administer the dose as ordered. Blue, clarify the insulin type and route. Yellow, give the drug subcutaneously. Green, question the insulin dose. What would you do? 10 units, NPH. Yep, the answer is clarify the insulin type and route. You can't give NPH through IV. Only regular insulin goes through IV. So you should clarify the order. Oh. An overweight 45-year-old with type 2 diabetes asks us about oral anti-diabetic. What should the nurse understand? Red cannot be used once the patient requires insulin. Blue may not be used if fasting blood glucose is too high. Yellow cannot be used if patients overweight. Green may be used with insulin in type 2 diabetes. I think I put the answers on 20 seconds. I don't know. I think I was supposed to change that. Sorry. Too fast. Okay, and the answer is maybe used with insulin in type 2 diabetes. And this is also in the textbook. I tried to put some pictures of the textbook here. I don't know if y'all noticed. So when y'all going over the question later, y'all can see like all the slides. Why was a patient's oral anti-diabetic agent changed from Coline to Ciprazide? Patient with type 2 diabetes asks the nurse why the provider has changed their oral anti-diabetic medicine from Oronase to Glucotrol. The nurse will explain that Ciprazide is red, taken on as many faces. Blue, we already answered everybody. Yes, is longer duration of action. Glipizide is a second generation sulfonylurea with longer duration of action. I'm sorry about the music. Which statement indicates the need for further teaching for a client with type 2 diabetes on metformin? This is also a prototype drug. Red, I need to constantly watch for signs of low blood sugar. Blue, I need to let the doctor know if I get unusually tired. Yellow, it is okay if I skip meals once in a while. Or green, I'll be sure to not drink alcohol or excessive while on this medication. Which one indicates? It is the yellow. If they say it's okay to skip meals, they're wrong. Let's see. I see Emily, Karen, and Brittany. Okay. And it says, I need to constantly watch for signs of low blood sugar. Sorry. I think I said the answer wrong. What is an example of a thiazolidine? Sorry. I don't know how to take that in. I'm trying to turn it down. Is that better? What is it? You got to write in the answer. What is an example of a diazolidine? And I made it a 45-second question. You just have to type it in. You have to type one of the meds in that class. Diazolidine. No Googling. Oh, I see someone put Actos. That's correct. I can't really see who put what was wrong, but I'll just show it and drop it off. And these are one of the prototype drugs is in a chart inside one of the chapters. So this is just a little picture of that. And of course, the drugs. Which medication should be withheld 24 hours before and 48 hours after a cardiac catheterization for a type 2 diabetic? And red is glipizide, blue is rebegaline, I don't know how to say that right, yellow is regular insulin, green is metformin. Which one should be held after? 24 hours before and 48 hours after. That's right, metformin. And this is one of our prototype drugs, so you need to know it needs to be withheld because of the risk of lactic acidosis. What instructions should a nurse include for a new client newly diagnosed with diabetes and prescribed Pharmacology? And the red is take your prescribed pills 1 hour before or 2 hours after the injection. Blue is inject the Pramlintide at the same time you take your order of other medications. Yellow is be sure to take it with food for no GI upset. And green is take immediately after a meal so you do not experience low blood sugar. Yep. And it is take your prescribed pills 1 hour before or 2 hours after the injection. And that's one of the key points you need to know about that. This is a type answer question, and that is the mechanism of action. The mechanism of action is enhances incretin activity, stimulating insulin release, reducing glucagon, and decreasing hepatic glucose production. Just name any med from that mechanism of action. You can name any medication from that. Look at y'all. Y'all pretty good. Like the spelling was off on some of them. Some of you had it right, but it was just spelled wrong. It's the gliptins. It was just the regular spelling, the ending. Sorry. A patient with type 1 diabetes is unconscious with a pulse. Which should be administered? CPR is red, blue is insulin, yellow is glucagon, green is orange juice. A patient with type 1 diabetes is unconscious with a pulse. Which should you do? Which should be next? That's right, glucagon. Emily, Brittany, and Queen Ash in the top 3. It's glucagon. That's one of our prototype drugs. What is the function of the thyroid gland? What is the function of the thyroid gland? Red, regulate blood sugar levels. Blue, control metabolism. Yellow, produce insulin. Green, filter blood. What is the function of the thyroid gland? Yep, control metabolism. It's Emily, Queen Ash, and Sarah. Okay. A patient on warfarin and digoxin develops hyperthyroidism and starts levothyroxine. What dosing adjustments are needed? A patient on warfarin and digoxin has hypothyroidism and starts levothyroxine. What dosing adjustments? Red, decrease digoxin and decrease warfarin. Decrease digoxin and increase warfarin is blue. Sorry, that one had long answers. I think they speed up the answers. Sorry. And it's increased digoxin and decreased warfarin. Okay. Before notifying the provider, the nurse will perform which action? The nurse is caring for a patient who is treated for hyperthyroidism. The patient reports insomnia, nervousness, and flushing of the skin. Before notifying the provider, what would the nurse do? What would they do first? Right. So speeding. And it's check the patient's heart rate to assess for tachycardia. Okay. A patient with Graves' disease has tachycardia, heat intolerance, and I don't know how to say that one. Which drug is used before surgery? A patient with Graves' disease has tachycardia, heat intolerance, and exophthalmos. Which drug is used before surgery? That's right, that was good. PTU. And the drug is propranolol. She said, I'm guessing. Why must insulin be given with subcutaneous injection instead of by mouth? Why must insulin be given by subcutaneous injection instead of by mouth? Yep, and the answer is digestive enzymes in the GI tract break down the drug and they prevent absorption. Okay. A patient on digoxin starts omeprazole for GERD. What should the nurse do? A patient on digoxin starts omeprazole for GERD. What should the nurse do? Decrease the dose of omeprazole, that's red. Blue, increase the dose of digoxin. Yellow, monitor for digoxin toxicity. Green, increase the omeprazole to 60 milligrams per day. And those are proton pump inhibitors, and that's one of our prototype drugs. And you will monitor for digoxin toxicity. You will monitor for digoxin toxicity. A patient with peptic ulcer disease on famotidine, 40 milligrams, daily reports no relief after 2 days. What should the nurse do? Okay, you will reassure that the patient that it may take 1 to 2 weeks notice for an improvement. I'm trying to, won't let me, okay, out of here. Okay, there you go. Reassure the patient that it may take 1 to 2 weeks to notice an improvement. And PUD is peptic ulcer disease. Oh, Lordy. Sorry. I don't know why it's so bad. A pregnant woman with frequent heartburn despite non-pharmacologic therapy should use which OTC therapy? Which product? Which over-the-counter product? That's H2 receptor antagonist. Sodium bicarbonate is blue. It's Mylanta. That's the only one that's really over-the-counter that you should use. And that's one of the prototype drugs as well. A patient reports flatulence and abdominal distension. Which over-the-counter medication should the nurse recommend? Patient reports gas and abdominal distension. Which over-the-counter would the nurse recommend? That's right. And that's Gas-X. This is a type answer question, and it's about a poem about a mechanism of action. So you just got to name a drug from that class. You got to name a proton pump inhibitor. Proton pump subdued, acid fades with gentle ease, healing stomachs please. Name the generic drug. Name any from that class. Yep, omeprazole. Omeprazole, all the zoles are proton pump inhibitors. Pantoprazole is going to be our generic drug, and omeprazole is one of our generic drugs, prototype drugs. When should a client with a gastric ulcer take sufragram 1 gram, sucralfate 1 gram by mouth 4 times daily? You're answering when. Up 1 hour before meals and at bedtime. A woman in labor is anxious and nauseous after receiving an opioid analgesic. Which IV medication should the nurse request? And that picture is given the mechanism and action and what it is. So that's a hint. Yep, promethazine. That's the answer. Finnegan. A patient with gastrointestinal has an PRN for Zofran. Which condition should the nurse administer this medication? What condition do you use Zofran? Yep, nausea and vomiting. Well, a lot of people got that one right. Nausea and vomiting. And it's a serotonin receptor antagonist, which is part of our drugs to know. All right. What information should a nurse include when teaching a patient about using transdermal scopolamine for a cruise? Scopolamine is one of the drugs that we have to go over. Red, you apply the patch as needed for nausea. Blue, apply the patch to your upper arm. Yellow, change the patch every 3 days. Green, restrict fluids while on the patch. Yep, and you would change the patch every 3 days. I think she worded it as every 72 hours. She definitely mentioned she might mention that on the test. Yep, you would change the patch every 3 days. Can loperamide be used to treat infectious diarrhea? Can loperamide be used to treat infectious diarrhea? Red results in CNS side effects. Blue has no effect on infectious diarrhea. Yellow, if taken once daily. Green may slow the exit of infectious organisms. Yeah, and it's actually green. It slows the exit. That's in the textbook. This is a type answer. Which should be administered to a child who ingested kerosene 20 minutes prior? And she mentioned this randomly in class, so it's only one thing that you can use for toxic substances. And that's actually an excerpt from our textbook. I see someone put charcoal. It's actually activated charcoal, but yeah, charcoal was close though. Why is atropine added to diphenoxylate for treating diarrhea? Why is atropine added to diphenoxylate for treating diarrhea? And red is decreased abdominal cramping. Blue is increased intestinal mobility. Yellow minimized nausea and vomiting. Yep, and the answer is decreased abdominal cramping. Atropine is added to decrease abdominal cramping and to slow the intestinal mobility through its anti-leucologenic effects. What should the nurse monitor in an older adult receiving? What should the nurse monitor in an older adult receiving it? Red, bradycardia. Blue, fluid retention. Yellow, urinary incontinence. Yep, respiratory depression. What is the best way to prevent traveler's diarrhea? What is the best way to prevent traveler's diarrhea? Yep. Drink bottled water and eat well-cooked meals. What is an appropriate goal for a patient with diarrhea? Now let's list some goals there. This is a question that was actually in the textbook too. Yep, less frequent, more frequent stools. More formed stools. Wrote it wrong, but an appropriate goal is that the patients will have formed less frequent stools, not an absence of stools. What should be recommended for a patient with less frequent bowel movements? What would you be recommending for a patient with less frequent bowel movements? Yep, increased intake of fluids and dietary fiber. Right now it's Emily, Queen Ash, and Karen. What information should be included when teaching a patient about psyllium? What information should be included? This is one of the prototype drugs as well. Yep, importance of consuming adequate amounts of water. That's a prototype drug that we need to go over. True or false? To minimize GERD, patients should drink red wine with dinner, use a small pillow, and wear tight clothes. This is like a giveaway answer. Yep, false. Why is methotrexate not used to suppress vomiting in children receiving chemotherapy? Why is it not used to suppress vomiting in children receiving chemotherapy? Yep, and it's extrapyramidal symptoms. Okay. Which medication order would the nurse question for a patient with Zollinger-Ellison syndrome? Which medication order would the nurse question? Which one would you not give? Yep. And that's one of our prototype drugs. Oh, I got a streak of 7, Emmy. What action will the nurse take if a patient reports no relief from famotidine after 2 days? Which action would they take? There's no relief from famotidine after 2 days. Yep, you will reassure the patient it may take 1 to 2 weeks. What will the nurse do if a pregnant patient asks about using misoprostol for a peptic ulcer? What would the nurse do if a pregnant patient asks about it? Would you recommend the use? Would you explain that it's not for pregnancy, which is blue? Yep, it's not for pregnant women. What treatment does the nurse expect for a patient with negative H. pylori test and peptic ulcer? What treatment does the nurse expect for a patient with those two things? do lansoprazole instead of nitazidine? That's a question in a textbook. Don't ask. Why is pantoprazole prescribed for a patient with an ulcer who continues to have pain despite taking famotidine? Why is pantoprazole prescribed for a patient with an ulcer who continues to have pain despite taking famotidine? Yep, and it is more potent than famotidine. How should a patient take liquid antacid medication for GI upset? How should a patient take it? Red, all of them should be taken safely with renal insufficiency. Blue, take 60 minutes after meals and at bedtime. Yellow, take with at least 8 ounces of water. Green, take with milk to improve effectiveness. Yep, take 60 minutes after meals and at bedtime. What is the purpose of the 13C urea breath test? What is the purpose of the 13C urea breath test? Yep, and it's test for presence of H. pylori. Okay. How long should a patient continue taking Reprazole for a duodenal ulcer? How long should they take it? And this is one of our prototype drugs. Red, 10 days. Blue, 2 weeks. Yellow, 4 to 8 weeks. Green, until the pain subsides. Reprazole, yep, 4 to 8 weeks. Oh, sorry, I went too fast with that one. Why are 2 antibiotics used to treat H. pylori peptic ulcer disease? Why do we need 2 antibiotics? Yep, compact bacterial resistance. Okay. How should a patient take an antacid with bromine and omeprazole? How should a patient take an antacid with bromine and omeprazole? Yep, 2 hours after. You should take it 2 hours after, because they slow the absorption. This is a type answer. Which antacid is most likely to cause acid rebound? And I put a couple of answer choices up there. We got aluminum hydroxide, calcium carbonate, magnesium hydroxide, or magnesium trisulfide. Which one out of those 4 causes acid rebound? And you got to write the answer. There's only one answer out of those choices. Nope. It's only calcium carbonate. Yep, 2 people got that right. Calcium carbonate. What lab test should be ordered for an elderly patient using magnesium hydroxide frequently? Which lab test? red, liver enzymes and serum calcium. Blue, liver enzymes and serum magnesium. Yellow, renal function test and serum calcium. Or green, renal function test and serum magnesium. Which lab test should they be ordered? Yep, renal function test and serum magnesium. Okay, this is the end. Let's see. Got Emmy in third place, Emily in second, and Queen Ash in first place. Finally, the game was over. I'm sorry it was so long. If you guys can message me the people, I can remember who won, but message me your cell phone number so I can send you the gift cards. No problem. I was wondering who that was. Okay, I see y'all tomorrow at clinical, and I'll send the people who won their cards. Let me take a picture of this for myself so I can remember.